Hello, my name is Karis, and I'm a Level 1 nursing student. My clinical instructor has assigned me to observe you today.
Excellent. Feel free to ask me any questions you might have.
Thank you so much. I look forward to learning a lot. So, you're taking care of the patient in room 622. Do you have time to give me a report?
Sure. This patient is here for, I'm going to do my little S-bar, and as you know, we've learned that to be situation, background assessment, and recommendation. This patient is a 67-year-old African American male. He's awake and alert and oriented times 3. Appears to be in no distress. He is presented to the office today with a type 2 partial thickness loss of dermis, presenting a shallow open ulcer on his heel. His code status is full. He has an activity as tolerated. He's on a diet, a diabetic diet, 1,800 calories, which is 2 grams of sodium, and his vital signs are to be taken every 8 hours. We did a CBC and a CMP. We're doing a A1C right now. We're doing a urinalysis, and then the doctor has ordered 4 milligrams IV for every 4 hours of morphine for pain, aspirin 81 milligrams by mouth, Simvastatin in the evening, and Lisinopril, also PO. Cardiovascularly, he denies any chest pain, palpitations, dyspnea, or edema, denies any syncope or caudation. GI, no nausea, vomiting, abdominal symptoms. Patient denies changes in bowel habits. Musculoskeletal denies any problems with range of motion. Developmental, he seems to be an alert and oriented adult. Respiratory, no cough, dyspnea, or wheezing or chest. GU, no flank pain. Dysuria, denies any pain with urination. Denies presence of lymph node tenderness or recent infection.
Thank you so much for giving me a report. Do you mind if I ask you a couple of questions regarding the medication administration?
Not a problem at all. What questions do you have?
Why specifically is this client receiving this medication? What action does the medication have on the body?
Well, we're giving him insulin. That's what the medication I'm going to be administering as. It's regular insulin, so its primary use is to treat patients with type 1 or type 2 diabetes. The effects on the body are for the treatment goals, including achieving appropriate glycemic control, reducing the development of progression of microvascular complications, and enhancing quality of life.
When should you question administering this medication?
You should question administering the medication whenever the glucose level or the sugar level is without a range or not within the doctor's parameters.
Does this medication have a therapeutic serum level?
This medication is long-acting, so it should be administered at the same time each day, 4 times a day.
Which vital signs must be monitored?
Heart rate, blood pressure, but as your nurse, you're going to want to monitor him closely throughout the entire shift for any signs of shortness of breath, wheezing, distress.
What physiological parameters